We're here to assemble stoves that will have external ventilation and hopefully make for a healthier home environment for the family.
Many of the children here are at risk for actually dying of respiratory illnesses. This is our hope that we will reduce the incidence of respiratory illnesses by putting in these stoves. We plant seeds and they grow, you hope, but you don't always see the results right away. This is the kind of work where you can see results right away.
Our heritage is based upon the Sisters of Providence, who are international and global in how they think and act, and I think it's an expectation and a hope that we will continue to find ways to be global citizens. Providence Health International is our way to share the talents of our people, the material resources we have, to benefit people in other parts of the world. But it's also a way for us to become a better organization, because our people who get involved in this kind of work, they come back as different people. Our work in Guatemala involves three areas: public health, surgical interventions, and education of health professionals. It's a unique culture and the richness of the Mayan tradition. I'm just amazed by how strong that still is in this modern day world we all live in. I think one of the things we can learn is that sense of community with which they live. The number one cause of mortality for children in Guatemala is respiratory disease. If we can make an impact on that with the stove project, that would be very exciting.
The people of Chioya are remarkably different in certain ways because of the circumstances that they're born into. They're a warm, generous, kind, complicated, fascinating people with a very rich history.
On all of our teams, there were local men, and at first their participation was assisting. By the end of the week, they were really taking the lead in installing these stoves.
They wanted to work in solidarity with us. They wanted to be a part of improving the health of their community.
The public health side is in partnership with Medical Teams International. We had had a long-standing relationship with MTI doing other projects in Haiti, in Guatemala, and Mexico. We also know they had the in-country staff to support this, and they have the ongoing relationships with the communities. That relationship is so important when you're doing this kind of work.
It's very much a training of trainers model that we have. Our Guatemalan staff training local volunteers to implement a lot of the public health work that we do in the rural villages. It's not charity, but it's really empowering people to care for their community, to work collaboratively with volunteers to really see improvements in health. If you want to serve the poor and vulnerable, you first have to know the poor and vulnerable.
The type of poverty we see is not the same kind of poverty we see in the US, and it doesn't fit neatly, and it's disruptive. It's good to be disrupted. I think it's very important for us as people.
I didn't realize how much this was going to touch me. And the joy that you can just feel sitting in the sun in a wood hut on a dirt floor with a child that you can't even speak the same language. It's just such a simple thing.
They stay in your mind, and you consider what is their reality and where are they going to be in 5-10 years from now.
I had this very cool moment where we had built a stove and everybody was standing around praying. I was watching the children there and kind of saying, because of this, you have a better chance. You have a slightly better chance. It was just a very cool, meaningful, spiritual moment for me.
We chose faith and practice because when it comes to providing surgery, we knew we needed to have the right partner. We chose them because they really have the infrastructure created in the country to handle such things as getting product into the country. They have the established relationships with the Ministry of Health to get all the permissions so people can practice medicine.
In Guatemala, 90% of the people have no access to health care. It's the 4th worst country in the world for chronic malnutrition. And so for us, we go to where they are, trying to meet the need that they have. The goal is to be the people on the ground that will be able to facilitate everything for the surgical teams and the medical teams to do what they do best. The surgical teams usually constitute about 40 people to provide the surgical care at Las Obras Sociales de Santo Hermano Pedro, as well as at La Regalindo Hospital in Retauleo.
The Guatemalan patients have such love and generosity and appreciation for what little things that we can do for them because they have so little. The need never ends. It's really a mutual care that we give them and a blessing of what they give us, because this is why we went into medicine.
The people here are from all over the country. Many of these people have been on a bus for 6 to 8 hours just to get to the clinic today and are overjoyed that they get to come face to face with us and have a hope that their problem can be improved or solved. And they tell you, I will pray for you, doctor, every day for the rest of my life and your life. And then you're just humbled by this incredible responsibility that we get to participate in.
My hope is that the faces and the experiences we've had stay alive within us and pass back through our hearts and continue to awaken us and break us open to the reality that we belong to a much larger community than the one that we see.
When we're able to use our gifts and connect our gifts with the needs in the world, exponentially we can make a huge impact.
We belong in a way where we're called to deeper responsibility, deeper recognition, and deeper compassion. When we act out of compassion, we are in solidarity with our brothers and sisters all over the world.